President Abraham Lincoln, during one of the most divisive periods in American history, stated that the role of public servant is to educate public opinion. With public opinion, nothing can fail, and without it, nothing can succeed. Those words rang true and became prescient during the controversial vote on the Affordable Care Act in 2010. Back then, I was a first-term member of Congress in the quintessential swing state, in a quintessential swing district within Ohio. And if you remember back then, the financial crisis that gripped Wall Street also crippled people on Main Street, as in the first few months of office, 800,000 people a month were losing their jobs. Millions lost their incomes, their purpose, and their faith in institutions as they saw wealthy bankers and investors take our nation to the edge of disaster. President Obama ushered in a sense of faith, hope, and optimism about America's future, and in the first few days of his administration, we all faced economic uncertainty. This situation didn't prevent nor deter the president from making big decisions or attempting to fulfill his campaign promises to reform health care. Politically, it seemed like a winner to take on the issue. Polling demonstrated that nearly 70% of Americans believe we needed to reform a system that had hurt so many citizens. If you remember, people were denied coverage because of previous health conditions. And if they changed jobs and committed the sin of having their heart issue or cancer treatments or diabetes cared for, your new employer and their respective health insurance plan wouldn't cover that pre-existing condition. Medical bankruptcy was the leading cause of financial turmoil in the country, as ordinary people placed second mortgages on their homes, withdrew money from their retirement accounts, and ran up credit cards to manage their health care costs. President Obama himself declared that if employers kept pushing citizens to Medicare and Medicaid, those trust funds would bankrupt tax expenditures. Something had to be done to help the American people. We passed the American Rescue Plan, which pumped billions into the economy to invest in critical infrastructure and get those shovel-ready jobs into action and help get Americans back to work. Well, that progress was slow. The leadership in the House of Representatives decided to press health care reform. I remember sitting in the Speaker's office after taking a controversial vote on cap and trade, which was a free market approach to help curb emissions and stave off climate change. It was a bipartisan idea championed by then presidential candidate John McCain and Sarah Palin on their presidential platform. The president wanted a bipartisan support for the bill and believed by introducing a plan largely pushed by Republicans, we'd get it passed. However, Washington is the only place where you can propose an idea, introduce legislation, and then campaign against it. And that's what happened. It was a tough vote, and special interest groups locked our office down with constituent calls and emails. Then the Speaker suggested that we were to follow the Senate with our health care reform plan. But the chamber spent a lot of time just trying to get a bill introduced. So the House introduced its version of health care reform, and that legislation sought to end both for-profit and not-for-profit Medicare Advantage plans. When Congressman Clyburn's office began to whip the bill or count the votes, I was a solid no, because you see, the largest employer in my district was Altman Hospital, and they insured nearly 100,000 people in my district in a not-for-profit Medicare Advantage plan. When they invited me to the Speaker's office to explain my position on this issue that I had campaigned for, reforming health care, I told them that I could not go back home and look 100,000 families in the face and tell them I voted to reform the healthcare system by eliminating your healthcare plan. It wasn't smart legislation, nor was it smart politics. The House leadership found enough votes to get the measure through without my vote. And let me tell you, saying no to constituents who really wanted Washington to do something and saying no to the Speaker and the President might be difficult politics, but politically, we knew that the Senate version of the health care reform bill would be the measure that was carried in the day. Attempting to educate the public opinion about this vote, it appeared that as if no one was happy. After this vote, I sent public position statements about what I wanted to see in the Affordable Care Act for it to get my vote. I combed my district looking for subject matter experts to help give me perspective about the reforms that were needed in the healthcare industry. And Dr. Arthur Lavin, chairman of the Doctors Organized for Healthcare Solution, DOCS, offered to meet with me and his team of physicians and help educate me about the necessity of healthcare reform. Docs provided me 8 reasons from 8 patients and 8 doctors as to why reform was so critical. Ending pre-existing conditions, changing directions because people were one medical diagnosis away from medical bankruptcy and financial ruin, and also introducing more competition into the system was necessary. Armed with their wisdom and their expertise, I traveled across my district to help educate public opinion. However, after meeting with subject matter experts from the healthcare industry, executives from the insurance industry, and reading letters and emails from my constituents, it was a story that touched close to home that pushed me even farther. On the Monday before the Sunday vote on the Affordable Care Act, the president flew into Cleveland Airport to speak about a woman who I didn't know even existed until the president began to speak of her. She was a woman who had had pre-existing conditions and found herself in the Cleveland Clinic fighting for her life as she suffered from another medical diagnosis. And as I learned about Natoma Canfield, her story brought me back to a place that I hadn't been since I was a young boy, standing at the foot of my mom's bed when we learned that she had had breast cancer. My mom is alive today because she had good health care coverage. And I was determined and bound by Natoma's story to help make a difference with my time in Washington. Her story and the story of so many others brought me to a place to vote for the Affordable Care Act and put my political future at risk. After losing my seat in part because of this bold stand on reforming healthcare, I went home in February in 2011 and spent time with my father that I probably wouldn't have if I was still in Congress, as his health deteriorated. He suffered and ultimately passed away because of a hospital-acquired infection. You know, an infection that could have been prevented in reforms that were in the Affordable Care Act to hold hospitals more accountable. We had just passed legislation to do that. And also, my wife had just suffered from spinal meningitis after being bitten by a mosquito carrying the West Nile virus. She suffered nerve damage, and it took years for her to recover. Her physiological condition has improved, but she's not completely healed. Her pre-existing condition would not be covered today if Congress didn't do its part to reform the healthcare system. In the end, we run for office not just to win elections. I've proven I can do that serving in the legislature and in Congress. I've won elections there. We run for office to get things done. And I'm proud to say that I wouldn't change my vote knowing the political outcome of that controversial measure that passed the chamber. Taking this position took strength, and I want to thank the docs who helped me find the footing during this process to provide me with concrete examples of how to better educate public opinion. Your advocacy helped save lives on a scale that is still being measured. And on your 20th anniversary, know that your efforts moved our country into a better place. Thank you.